reach the expectations of this new program?
There really are, I believe, one or two ways to address that. As I heard the question, incentive-based work does produce some concerns from a couple of perspectives. Oftentimes, workers on incentive programs do not want to report injuries because it clearly takes them out of the productive stream and they earn less. In some economies, workers simply can't do that. They must bring home money. The second piece to that is when there are incentive-based programs, rarely, even in the United States, are the employees involved in what the benefits might be or how the incentive program is structured. So it's important to involve workers in incentive-based programs because they do improve productivity and you can minimize the health impacts.
Let's ask all the people that are making phone calls to stay on the phone line until the expert finishes the question. That way we don't have any confusion. Let's go now to Panama. The question comes from the Universidad Tecnológica de Panama. Go ahead. Good morning. What would be the most effective way of controlling stress in the workplace? Thank you.
Okay. Much literature that I have looked at, and this is international literature, for example, from the World Health Organization, from the ILO or International Labor Organization, talks about the involvement of constituents, workers, employees, in the processes that they're involved in, especially the process of change. Stress, unfortunately, comes from several places. Some of it we bring ourselves just by our very nature. Others come from the process, the physical hazards. Others comes from the expectations, as the previous caller was alluding to. If we can reduce physical hazards, we'll find that stress is reduced. If we can involve workers in the processes and involve them in how work is done, what I referred to in my talk as the organization of work, stress can be reduced. The other thing that's very beneficial that we haven't spoken of today to any great extent is what happens outside of work. There are advantages to workers, employers, and the external constituents, for example, families, medical practitioners, to be involved in working on health, general health, if you will, recreation, the availability of having some fun and relaxation in life. And by integrating all three of those aspects, we find that stress is reduced. I don't want to underscore the importance of not bringing stress to work because we do need time to relax and sort of come down from our processes. Reduce the physical hazards, understand the process, be involved in change, and reduce stress environmentally and outside of work. And by integrating the three, you'll find that there are much improvements.
And from Panama, we go now to Santo Domingo, and the following question comes from the Universidad del Caribe. Go ahead. Welcome. Thank you. Good morning. I would like to know what is the correct pronunciation of Hijón and what is this method all about?
The correct pronunciation is Qigong. It's actually a Chinese character, and it's described in many different ways. In Wade Giles, it's spelled C-H-I-K-U-N-G, but in Pinyin, which is the accepted romanization of the Chinese language, it's Q-I-G-O-N-G, but the tone itself is Qigong.
We made that clear. The pronunciation is Qigong. Let's go now to a question that arrived via fax. Now we're going to Celaya, where Celaya, Mexico, there's another live question. Good morning. The question is, most businesses have a medical area focusing on work-related injuries. Do you know of any experience that companies have that focuses on mental health of the workers and what are the elements of health, not physical, but the psychological approach that we have to take to improve productivity?
Yes, great question. There are organizations worldwide, but specifically my references would be to the United States, where, for example, employee assistance program representatives, including mental health representatives, are actually employed or are contracted for an employer to assist workers with mental health or psychologically related issues, including things like financial problems. So many employers, primarily the larger ones, very large ones, would have internal resources. Many smaller to medium-sized businesses contract these services to providers, and they've seen many benefits to having workers have immediate access to assistance such as mental health care workers, family and child health practitioners to help with those dynamics of life so we reduce the stress outside of the workplace. Very, very good question.
Let's go back now to Brazil with the participation of Furnas Centrais Elétricas. Welcome.
Good morning. Here in Brazil, workers comment that the main violence caused on workers, the so-called psychological violence, are the ones related with the administrative measures related to the dismissive process. Because serious hazards for the workers. So is there any news that from responsibilities for the management and the governors for these hazards? If it's the case, which are the levels in the world? Thank you.
Thank you, and I hope you're still there. I need a little clarification on that.
Yes.
Were you saying that much violence in Brazil is the result of domestic problems?
No, dismission. People are being released from their workers because of the privatization.
Oh, I see. I see.
So it causes a lot of hazards, and people become anxious, and it causes a lot of hazards in their relationship.
Well, clearly from a work dynamic, anxious workers or those that are anticipating being laid off or terminated tend to not be as cognizant of the hazards of work. I know of no international standards or activities that are going on other than some general studies the International Labor Office has undertaken that deals with safety, security, violence in the workplace, including the transition of economies and the outcomes that those stresses might have. I don't have a particular reference for you, but the ILO or International Labor Office resources do have an annual publication that talks about safety at work, and it is a very good resource, and you might find that and look at that because they do talk about, again, the transition of work and economies and the outcomes from a safety and health perspective, and that might help address some of your questions.
And from Brazil we go to Argentina, Municipalidad de Colonia Carolla. Welcome. Thank you very much. Good morning. The question is, what is the correlation between stress and work-related injuries and the length of the workday?
Very, very good question. Stress comes in a couple of different ways. Some stress is physical stress. One of the outcomes of physical stress that's clearly related to the dynamic of the length of employment are cumulative trauma or repetitive stress injuries. By not allowing the body to resolve from certain stresses, if you will, we see things like carpal tunnel syndrome or shoulder injuries. Tennis elbow, what we call in America, for injuries that happen to the elbow from repetitive motions. That's a physical stress. The corollary psychologically is that workers who are under stress mentally tend to miss work. Their work performance suffers from a quality perspective. They may have behavior changes, all of which can be seen. They're a little more difficult to measure, but they can be seen, and therefore they can be counteracted. So one deals with the physical aspect of stress, the other with the mental, both of whom are capable of being addressed and resolved in the workplace.
Let's go back to the capital of Mexico. This question is coming from the Comisión Federal de Electricidad, CECAP, Mexico, Federal District. Mexico. Hello? CECAP. Congratulations and greetings to all the people that make this video conference possible. The question is the following. The behavior of the individual at work comes from the behavior of the family, or is it the other way around? Thank you.
If I might give you a quick piece of history. H.W. Heinrich, who was a safety pioneer in the United States in the 1930s, said that much behavior at work was due to the ancestry of the worker. But we really find it both ways. What Heinrich meant was that our socialization, not necessarily our family background, but our socialization does impact how we do at work or how we perform and act at work. So clearly, I think you're headed in the right direction with that question and how it's oriented. The second piece of that is that sometimes our work and how we are socialized on the job impacts our performance as well. So it's really both, but there is significant consideration from the historical perspective that our family and our socialization impact our behavior at work, if you will. Yes.
Thank you, Mr. Hopwood. Let's go back now to module number 2, where Dr. Johnson will talk about some alternative health methods and how they apply to our work.
Thank you. Given the scenario of today's work environment outlined by my colleague, Mr. Hopwood, we find more and more people looking to alternative forms of healing because they realize that the stress of maintaining a competitive pace in this rapidly changing world can be extremely detrimental to their health. Alternative forms of healing include treatments that not only affect the body, but also the mind and emotions as well. Some examples are acupuncture, massage, homeopathy, ozone therapy, color and tone resonation therapy, and qigong therapy. Some of these healing and preventative methods fall under the traditional Chinese medicine or TCM philosophy. TCM consists of stimulating and directing life force energy within the patient's body in order to effect a balance and healing. There are 4 distinct branches or systems of this type of clinical healing: acupuncture, herbology, tissue regulation, and qigong therapy. Each doctor from these systems undergoes extensive training in their field of expertise, including clinical diagnosis and symptomology, various modalities of healing, and internship. Although allopathic medicine, which is an old terminology used to describe the practice of Western medicine, is extremely effective in terms of treating the patient's symptoms, and for surgery, it is very limited in its scope of preventative medicine and healing the body, mind, emotion, and spirit, which connects and governs our physical constitution. TCM and Western medicine are quite different from each other, even in their understanding of anatomy and physiology. In 1993, while interning at the Shiyun Hospital in Beijing, China, I was amazed at most of the doctors' basic understanding of Western anatomy and physiology. When I inquired as to why their comprehension level was so limited, the response was, "Oh, that's because you study the dead. We study pools, rivers, and currents of life force energy. When the body dies, this energy returns back to its original source, back to the heavens and earth, and all that's left is lifeless tissue. Therefore, our understanding and the priority we place on anatomy and physiology is quite different from yours." Even the approach to healing is different from both Eastern and Western clinical modalities. For example, while Western medicine focuses on healing the symptoms, traditional Chinese medicine focuses on healing the root or origin of the disease. For example, in Western medicine, a tumor, depending on the specifics, is usually removed by surgery. In traditional Chinese medicine, however, a tumor is viewed as a flower, and its pathology must be retraced to find its roots or origin. Once its origin is obtained, then the root system is destroyed in order to destroy the flower and dissolve the tumor and prevent it from returning again. Traditional Chinese medicine maintains its conviction that the body stores and responds to the direct and indirect effect of specific emotions. For example, anger is stored in the liver. Fear is stored in the kidneys. Worry is stored in the spleen. Grief is stored in the lungs. And joy is stored in the heart. I will discuss this in more detail a little bit later. Of the many alternative healing methods in use today, I specialize in Qigong therapy, which is a part of traditional Chinese medicine and is regarded as a natural holistic healing system. The use of medical Qigong therapy has been documented in China for over 5,000 years. Long before Western medicine was established, the Chinese physicians had already incorporated systematic healing modalities which provided effective and served society in maintaining health and healing. Qigong translates into skill of energy, and its primary focus is in balancing the body's life force energy. Life force energy is believed to consist of electromagnetic energy, heat, resonant vibrations, and light. Therefore, Qigong relates to the skill of balancing these types of life-giving energies in order to facilitate health and healing. This is implemented by stationary and dynamic movements. Some stationary techniques include specific arm motions designed to incorporate the torso and relax the major and secondary muscle groups of the body. Dynamic Qigong consists of large, more mobile motions than those of the stationary type, such as stepping and bending. For those who are not able to accomplish the dynamic movements of Qigong, great benefits are still reached through practicing stationary Qigong alone, therefore making Qigong all-inclusive as far as who is able to practice. Many who have been successful in the use of Qigong have found that, despite their differences, traditional Chinese medicine and Western medicine can work hand in hand. For example, I receive referrals from Western medical doctors who refer patients to me with benign tumors and cysts who wish to avoid surgery. I have had an 80% success rate in treating these conditions. Qigong, in conjunction with other alternative healing methods, such as acupuncture, herbs, and massage, is also extremely effective in treating conditions such as fibroid tumors, chronic fatigue syndrome, and hypertension. I have also assisted several medical doctors in working to decrease the medications of severe cancer, tumor, and hypertension patients. Qigong is not limited, however, to the treatment of only severe diseases. It can also be used to treat several common health problems as well. For example, I have several patients I treat for migraine headaches. One in particular has a very stressful job, being in management in a progressive, demanding field. This person turned to Western medical doctors for help. The doctors treated the symptoms with drugs, using stronger doses as the migraines became more frequent. They eventually built up to the use of self-administered injections, which were effective temporarily, but the migraines returned within a short period of time. This patient came to me concerned about the amount of time this pain was keeping him away from work. He had also come to realize that the treatments were merely masking the symptoms and not eliminating the problem. Through Qigong treatments, the patient was able to release years of pent-up emotional stress, which greatly enhanced the healing process. The patient was then re-educated on the practice of Qigong therapy for stress management. Before long, he was able to stop taking medication, and now this person is equipped with the knowledge and skill to regulate and maintain the stress levels needed to prevent illness and to lead a more productive life. As discussed earlier, traditional Chinese medicine maintains that the body stores and responds to the direct and indirect effect of specific emotions, which regulate the body's stress factor. Again, for example, anger is stored in the liver, fear in the kidneys, worry in the spleen, grief in the lungs, and joy in the heart. The body is not developed to handle excessive amounts of emotional and sensory input, resulting in stress. Stress is defined as an overstimulation or overexcitement of the body's nervous system. Unable to handle this overstimulation, a physical breakdown is imminent. A breakdown of tissue function is also evident of this fact, resulting in organ dysfunction, tumors, cysts, and eventually cancer. All emotional traumas deal with the body's ability or inability to handle painful emotional feelings. For example, the feelings of hurt are experienced in 4 specific forms of emotional transformation. Anger is a function of focusing on past hurts and affects the liver. This can overheat the blood and lead to migraine headaches, ovarian cyst, uteral and prostate tumors, and cancer. Grief is a function of focusing on present hurts and affects the lungs and could lead to breast tumors and cancer. Fear is a function of focusing on future hurts and can affect the kidneys, leading to chronic fatigue syndrome, fibromyalgia, as well as a breakdown of the endocrine system. And worry is also a function of focusing on future hurts, and because of excessive mental focus can lead to spleen and stomach dysfunctions, ulcers, and digestive problems. There have been many documented cases of cancer patients having their disease go into remission after undergoing Qigong treatments. Several hospitals in China use both herbs as well as Qigong therapy in order to initiate these types of remissions. Although Qigong is not a cure-all, it is and has been proven to be extremely effective when used in clinical application for treating internal organ dysfunctions, tumors, cysts, and even certain types of cancer. It is also extremely effective as a preventative agent when used in maintaining health, healing, and disease prevention. Some examples include the following. In other studies done at the Nishimoto Pain Clinic in Japan, it was found that patients suffering from autonomic nervous system disorders received 73.6% pain relief from Qigong treatments. In a study done at the Gongganmen Hospital for Traditional Chinese Medicine in Beijing, China, patients treated with Qigong therapy revealed the following. 87.7% of advanced cancer patients treated experienced regained strength. 63% reported improved appetite. 50.54% experienced body weight increases of more than 3 kilograms. And 33.3% of patients with gastrointestinal disorders experience relief. The phagocytes, which our bodies uses to combat cancer cells, increased by 12.31% after Qigong treatments. As we realize more and more how important keeping our stress levels down is for our general well-being, the more corporations are coming to believe that organizational health, healing, and Qigong exercises should be integrated in order to produce a stress-free workplace. Through establishing both corporate and administrative Qigong classes, many organizations have found that stress levels greatly decrease, reducing the anxiety and depression of overworked employees. Implementing such a program in your organization will facilitate a more calm and less volatile workplace. In my experience, the most important factor in an organization's management deciding to implement a Qigong program is the stress reduction factor and the potential increased vitality and health of its employees. A program of 3 times a week for 30 to 45 minutes each session is extremely effective. It can be done in-house, but it is crucial to provide an environment to practice that is quiet and free from pressure or strain. Usually a professional is brought in to set up the program and to help incorporate Qigong into each individual workplace. Once the employees are trained in the techniques, the cost amounts only to the time spent away from work. Although I do recommend investing in a regular visit from a professional to monitor the progress and offer support. Organizations have found that the benefits derived from implementing a Qigong program can pay off financially. Providing employees an outlet for stress enables the employee the mental and emotional reserves needed to excel in today's demanding and competitive workplace. As a form of preventative medicine, it can reduce medical costs by allowing the employees to take responsibility of their own bodies and to control their own stress level. Less stress greatly reduces sickness. When the employer arrives at the office in the morning, the employees look to him or her to set the mood for the day and for the entire office. It is a known fact that stress trickles down from management level to the employees, and that corporate executives set the tone for the level of stress and productivity. If, for example, a manager or executive officer is in a state of turmoil and emotional disturbance, his or her employees will suffer accordingly, thereby having an adverse effect on concentration levels and productivity. Qigong is an ancient proven method for reducing stress and clearing the mind. It allows one to have mastery over his or her body, thereby increasing creativity and promoting the development of new ideas. If those in a management or leadership role are calm and collected, it follows that they are more likely to make intelligent business decisions. Qigong can reduce emotional and financial stress for both the corporation and the employees by increasing productivity, reducing absentees and sick leave, improving relationships between corporate executives and employees, and improving morale. The success of the Fortune 500 Japanese corporations is due partly to the Japanese techniques in stress management. Once they began to initiate corporate relaxation and stress management programs, the success of their corporate businesses skyrocketed. As Qigong is fairly new to the Western public, most major American corporate organizations are not yet aware of its potential. Through time, it is hoped that this powerful stress reduction and healing art will soon become popular outside of China and the Asian corporate business world. Already in Spain, Qigong practice in stress management is beginning to have a very positive effect among certain groups of successful businessmen and women. Through breathing, relaxation, and mood control exercises, the participants experienced increased energy and vitality, stronger attention and concentration, more sensitivity, intuitiveness, and consciousness towards themselves and their environment. By establishing a priority of a stress-free workplace, not only will employees' attitudes shift from a survival mode to a successful and goal-oriented one, but also corporate teamwork can be successfully enhanced. After all, teamwork is the ability to work together towards a common vision, the ability to direct individual accomplishments towards organizational objectives. It is the fuel that allows common people to attain uncommon results. Thank you.
Thank you, Dr. Johnson. Let us continue with the second question and answer session. The first question comes from Panama, from the Centro Regional Colón. Go ahead. Greetings from the Centro Regional de Colón, from the Universidad Tecnológica de Panama. We are today starting transmission with the parabolic antenna. The question is, the labor style, is it related with the style of leadership that an employer has within an organization?